Hello and welcome back, and today we are discussing yet another case of hair transplant, a beautiful transformation in this individual. And he came to us with grade 4 to grade 5 male pattern baldness, and we advised him to undergo a hair transplant, and you can see his results, how beautifully he has transformed, and he is looking much younger than what he was before. So I'll take you through his journey and I'll explain you everything, and if you have this issue, do subscribe to our channel. So friends, this individual, he had already tried various medical management. He had taken minoxidil, he had used finasteride, he had also underwent multiple sessions of PRP, but you need to understand that once the roots are lost, the only way to gain them back is through a hair transplant surgery. Medical management is to enhance the roots that are already present there, but for the roots that are already lost, for the bald patches, all we can do is go for a hair transplant. And for him, we decided to undertake an FUE, follicular unit extraction method of hair transplant, in which we took out almost 4,000 hair follicles from his donor area. His donor area was the scalp area from behind, which is also called as the permanent donor area. This hair, even if you see, for those who have lost almost all of their hair, those who are grade 6 to 7, this is the area where you always have hair. So this is the area which is the permanent donor area. From here, we harvested around 4,000 grafts. Each graft would contain multiple hairs. So in few grafts, there would be 4 hairs, there would be 3 hairs, 2 hair or 1 hair. So depending on how good a density you have, the results do vary. For him, we took out almost 4,000 grafts, and these grafts were then inserted in the front. We had marked him initially, and you can see from the pictures the zones in which we had divided him. We had marked the areas where we want to give a very high density in the front to give a very good hairline, then also in this area to give a good density, and then in the crown area. So all the 3 areas were marked and the slits were made, and these grafts were then put inside these slits. The whole process took around 6 hours, and this needs almost a team of 3 to 4 people to get the whole process done. Everything was done under local anesthesia, and this is a very pain-free surgery. Only the initial injection to give the anesthesia is slightly painful, but after that it is almost pain-free, and you are very comfortable during the whole process. During the process, you do get breaks for your breakfast, for your lunch, and for toilet as well. And once the surgery is done, this is how you look immediately after your hair transplant. This is from the front, sides and the back. Once your transplant is complete, you have to take care for about 3 weeks for the roots to take properly. You can always subscribe to our channel. We continuously make videos on how to take care of your grafts after the hair transplant. Once all this is done, this is his picture after a few weeks, and this is once the results are final, that is at about 6 months. So usually my patients, I advise them that you will get your hair back by about 6 to 9 months. So if you have a very big function coming up, so do your hair transplant at least 9 months prior to that. So that is all from my side. If you have any further questions regarding hair transplant, or if you want to get a hair transplant done, please do get in touch with us, and we'll be happy to help you. Thank you and have a nice day.